Ladies and gentlemen, welcome. Thank you so much for coming to our Faculty of Health and Medical Sciences showcase this morning. My name is Liz and I'm a future student advisor in the university. Firstly, I'd like to acknowledge that we pay our respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on today. We acknowledge the deep feelings of attachment and the relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and cultural beliefs. The session is being streamed and recorded via Facebook Live and will be available online for future reference. So welcome to our live stream viewers. Now it is my pleasure to introduce you to our academic staff here, which is Professor Anna Johansson and also Program Coordinator Peter Strelin. Welcome. So if the two of you would like to come and present your components, that would be lovely. Thank you so much.
Alrighty. So, can you hear me okay? All going okay? Good. So my name is Professor Anna Johansson and I'm the head of the School of Psychology here at the University of Adelaide, and I'm very proud to be the head of the school. It's a wonderful school and I'm hoping that today when you hear about what we have to offer that you will like to come and join us in that school. So I hope that you'll join us too at this university. It's the third oldest university in Australia and it's very highly ranked. It's ranked top 1% in the world. We have a number of amazing alumni, so people who've studied with us and then gone on and done great things, including 5 people who've won a Nobel Prize. So that's pretty amazing. When you look at all the international rankings, so all the universities in the world are ranked and there's all different ways in which that's done, that ranking. But the University of Adelaide always comes out somewhere near the top. So you'll see here that we are in the top 150 in the 3 different kinds of primary ranking schemes that are used. We've had over 110 Rhodes Scholars and we're a member of the group of 8. So that means that in Australia, once again, all the universities are ranked and there are 8 that are in a coalition, if you wish, and we are one of those 8. There are many, many staff at the university. There are many, many students. We have students and staff from all over the world, and most of the time, if you come to study psychology, you will be on the North Terrace campus. This is part of the North Terrace campus, this building, but primarily if you do psychology, you'll be down the other end of the road near the art gallery and all the shops and all the other nice things and restaurants. So the university is in the middle of town, as you can see. And if you study psychology, you might sometimes come down here to work. You might sometimes go to the Wait, not usually, but when you get further into your studies, there might be electives or things that you do around food where you might be interested. And one of my areas of research is companion animals and health, so you might end up down at Roseworthy in the vet school doing something there. So we're in the Faculty of Health and Medical Sciences. The School of Psychology is one of the 5 schools in the faculty. The faculty itself, again, is a very highly ranked faculty. I won't read this all out to you except to flag to you that across the state we are number 1 in medicine, nursing, dentistry, and more interesting for you, psychology. I mentioned that we have some amazing alumni from this university. These are 2 fairly famous people. One of them you've almost certainly heard of, the other one maybe not. Have you all heard of Howard Florey? Yep, okay, so he discovered penicillin and basically has been responsible for saving the lives of literally millions, if not billions of people. And then Robin Warren, we have a laboratory here, a simulation lab called the Robin Warren Simulation Lab. And when you study psychology, when you get into the senior years, if you go into years 5 and 6, you will do some of your work in there. So he's very famous because he worked out that stomach ulcers were caused by Helicobacter pylori. We have 5 schools, as I mentioned, and the one that we're interested today in this faculty is the School of Psychology. And I've already told you that we are ranked, and this school is ranked first in the state. We're ranked 9th in Australia, which is not bad because there are quite a few schools of psychology around Australia. And we are globally in the top 101 to 150, which you might think, oh, is that good? Well, yes it is, because again, psychology is a very popular subject across the world, so there are a number of schools. I'm hoping, as head of school, that in the next few years we will rise even further up those rankings. Our faculty is very much focused on career readiness, so most of the people who come out of the faculty will go on to a career of some sort, and that is true of psychology as well. So in our curriculum we have a lot of hands-on experience, a lot of opportunities to go and do studies overseas internationally and learn skills, and Associate Professor Strellin's going to talk to you a bit more about that when he takes over from me in a moment. So psychology, you will learn about research and you will develop your practical research skills. You will, depending on which of the psychology programs you choose, and again Peter will tell you a bit more about that, but if you choose the Bachelor of Psychological Science as your option, you'll have more than 35 different majors that you can choose from to pair with psychology, and Peter will tell you a bit more about why that's interesting. And whichever program you choose, you will absolutely definitely have knowledge and skills that will translate into a myriad of different careers. So again, we'll talk a bit more shortly about the fact that not everyone who studies psychology becomes a psychologist, but everyone who studies psychology can go on to an amazing career of some sort of their choice with that base knowledge and background behind you. In our school, we have a number of people doing research. Almost all of our staff are scientists of some sort, so psychological scientists, and we do applied work as well as basic science. This is a picture of someone doing an EEG. This is actually Scott Clark from psychiatry, but we collaborate with our colleagues in psychiatry and we do research with them, as well as a number of people in other areas of the faculty and across the country and across the world, in fact. We have a number of industry links. There are kind of 3 main streams or areas that our teaching and our research hangs around. One of them is health, lifespan and disability. So again, Peter might talk to you a bit more about that. Another is brain and cognition, and another is social and organisational psychology. And I think it's really important to flag that our school is quite special, not only in the state but across the country, in that we offer an organisational and human factors master's program in Year 5, Year 6, which very few other places in the country offer. We also offer a health master's, so a master in health psychology, which I'll talk to you about shortly, and we are one of only 2 schools in the country that offer that. So we have a very nice nexus between our teaching, our research and our postgraduate programs. We have some amazing teachers. We have teachers that have won prizes nationally and locally and in the state. Our teaching focuses on students, so we have a student focus and our students will talk to you a bit more about that. And we try very hard to be flexible, so every year we bring out new innovative ways of delivering our curriculum for you. As I've mentioned to you, we have 3 master's degrees and I'm going to talk to you about them at the end, because now I'm going to hand over to Peter and he'll tell you some more about the journey that you might like to take with us.
Okay, thanks Anna. So I'm Associate Professor Peter Strellin. I coordinate the one of the programs in the school, the Advanced, Bachelor of Psych Honours program, and I also, if you come and join us next year, you'll see a lot of me in first year. I coordinate the first year research methods course and also teach social psychology as well. So, as you can see here, to go on and become a registered psychologist, so this means you can hang out your shingle and say, I have done all the required study to be able to formally counsel people. There's a 6-year study journey. So if we work backwards from that, you would do in 5th and 6th year, you do Master of Psychology, and you can do clinical psychology. So this is specialising in the assessment, treatment and prevention of a wide range of emotional and behavioural problems. You can do health psychology. So health psychologists specialise in the relationship between psychological factors and health and illness. You could also be an organisational psychologist. And so this is where we apply our knowledge of human behaviour to enhancing organisational effectiveness, productivity and well-being. We should also point out that this becoming a registered psychologist is not the only endpoint of a journey here in if you study psychology. You could do a PhD. So if you were to look at the Master of Psychology line there and imagine PhD next to it, that is another pathway that a lot of us go into. In fact, everybody in our school has a PhD, or the academics. So that is another direction that people can go. At 4th year, we have honours, and honours is, I guess, the year that most students are striving to get to. Getting into 4th year opens the door to begin. If you get really good grades, that then gives you an opportunity to apply to do Master of Psychology or to do a PhD. Getting to 4th year honours, we have 3 ways of getting there. So first there is the Bachelor of Psychological Science. There's the honours degree of Bachelor of Psychology Advanced, and you could also do Bachelor of Psychological Science graduate entry. So I'm just going to talk a little bit about the Bachelor of Psych Science. You're going to be able to learn about, I guess, whether or not you do a BPsych Sci or you're in the advanced program. In the first 3 years of the course, our aim is to give you a broad introduction to psychology. And psychology is a really big area. It's got a lot of sub-disciplines, and it's actually not just about clinical psychology. So there's a lot of sub-disciplines to psych. So whether you do the BPsych Sci or you're in the advanced program, we're going to give you exposure to all the different parts of psychology. The thing that distinguishes the BPsych Sci is the fact that you can do a second major. So you do your 3 years, and in that 3 years you also have the opportunity to do a major. So this is what the course looks like, the program looks like. In year 1 you do 4 core psychology courses and 4 electives. In year 2 you do 5 core psych courses, and then students can choose from either a second major, or you can continue to choose from a wide variety of electives. At year 3 you would do 4 core psych courses, including a compulsory research methods course, and 4 courses you can select from a psych course or an elective. And if you're choosing to undertake a second major, the electives in 3rd year would consist of second year major courses. I'm going to come back to this slide. I'll just give you an indication of the range of second majors that are available to people. I won't go through each of them in turn, but you can see here that there's a lot of options when it comes to choosing a second major. So what is really attractive about the BPsych Sci program is that opportunity. Get exposure to psychology and to opportunity to do a second major. Once you've done your 3 years, you have the opportunity to apply to get into honours, which is 4th year. As you can imagine, as we go along, things getting increasingly competitive, and so then we're interested in students' GPAs at the end of 3rd year. It's a competitive process to get into honours. Some students will choose to leave after 3 years, and one of the, we think the exciting things about a degree in psychology is the fact that it makes students really attractive to potential employers. Employers like the idea that you know something about human behaviour, and if you think about work, everything in our lives, work, etc., is all about how people interact. And so employers are really interested in getting graduates who have some understanding of how the mind works, of human interaction. You're also going to come out really employable and marketable because you've learnt some skills that aren't necessarily inherent in other disciplines. So when you come out with a psychology degree, you have learnt how to synthesise information. You have learnt how to critically analyse claims. Your understanding of research methodology is superior. So there's a lot of things that make psychology graduates very attractive. The other pathway that we have, the main one, is a new program. It's the Bachelor of Psychology Advanced Honours. So as the advanced label indicates, this program is available to a small select group of applicants. So the SATAC entry was 95 last year. Now what distinguishes this program is several things. Firstly, you're going to be doing, if you're in this program, you do pretty much all psychology. So you will not be doing a second major. You will do some electives in first year and second year, but by the time you get to 3rd year, it's all psychology. You maintain a GPA of 6 throughout, and that means that you will then go into honours. And so one of the difference here with the BPsych Sci is that if you maintain a good record across your 3 years, then you're automatically heading into honours. In addition, in the BPsych Advanced Honours program, we are encouraging a cohort experience. At the moment, there are only 50 students in this program, and this is compared to 250 at least in the BPsych Sci, 400, 300. The numbers don't matter. 50 to about 300. And in addition, there's a mentoring program as part of the advanced degree. So this year, students in the advanced program have the opportunity for one-on-one mentoring with an academic member of staff in the school. We also have a number of VRFs, this is visiting research fellows and clinical title holders, and they are also part of this program too, providing one-on-one mentoring. Okay, so just a few details about what's involved in that program. So very similar in the first 2 years to the BPsych Sci, where you've got 4 core psychology courses and 4 electives, and then 5 psychology courses in second year and 3 electives. By the time you get to 3rd year, as I said, you are doing entirely psychology. At 4th year, so this is where people in the BPsych Sci would be applying to get into this program. If you're in this advanced program, then, as I said, you keep your grades up, you're automatically in. This is where students will do a 10,000 word research thesis, independent piece of work. This is where you are, but you're also, each student also has their own supervisor within the school. And fourth year students have coursework as well. One thing that I want to emphasise about, regardless of which pathway you choose to go through psychology, it could mean, as I said, that maybe after third year or maybe after fourth year, you decide that you've got all the psychology that you want or need, and you don't want to be going further to being a clinical psychologist or a health or organisational psych, or you don't want to do a PhD. As I said, you are highly marketable. And I just want to give you a sense of the jobs that people with psychology degrees get into. So I've noted a few here, and on a previous slide, similar sort of ideas. But we know that our graduates go into human resource management. They go into advertising and marketing. They work in government agencies where they do evaluation and other applied research. They work in mental health services, in youth work, in family and social services. They're in the private and public sector management. They work in juvenile justice and corrective services. They've been involved in relationship counselling. They work as residential care workers, juvenile justice and correctional services, and so on. So, as I've been saying, there's a lot of opportunity for graduates, even if you decide that you are going to depart after fourth year. Okay. I'm going to talk now just a little bit about what actually happens in first year, because that will be of immediate interest to you. So broadly, our aim in first year is to introduce you to the range of areas that are in psychology. And in doing that, you're also going to develop research skills within the scientific framework, and you're going to develop critical thinking and evaluation skills, and understanding the importance of evidence-based inquiry. You're also going to develop writing and communication skills and develop core applied skills. So in our teaching, as Anna has indicated, we use a combination of online learning combined with face-to-face teaching. So our school was actually at the forefront 6 or 7 years ago of a new movement in education globally, and this is known as the flipped classroom. And many of you have probably already had exposure to the flipped classroom at school, but basically it has revolutionised the way that people teach and the way people learn. And we're one of the first schools in the world to actually use this approach. And you'll be seeing it in pretty much all of our first year courses, at least. And the beauty of this approach is what it recognises is that these days, and as our Facebook Live audience is already doing, you don't actually need to physically come and sit in a large lecture theatre for 50 minutes, which traditionally was the approach, and listen to someone like myself just talk at you, and you would sit there and quietly take it all in and then go away and do some homework. The flipped classroom says actually you're better off being exposed to new information online in your own time, because we've now got the technology to be able to do that pretty well. So we provide lecture material to people online. You engage with it in your own time, but then when you come to university, we're going to use that time far more productively and give you the chance to actually interact with me, for example, as a lecturer. So students in our courses have the opportunity to interact one-on-one with experts in the field. We use a combination of problem-based learning approaches and other similar approaches, a lot of small group work where we do applied problem solving. And so this way, students actually learn a lot better and acquire deeper knowledge of the concepts that we're introducing them to. So this is a hallmark of our teaching. So in first year psychology, this is pretty much covers everything that you'll be exposed to. So we look at memory and mental health, learning, social psychology, motivation and emotion, intelligence, personality, developmental psychology. You get training in research methods. There's an entire course on that. Biological basis of behaviour, cross-cultural psychology. Okay, that is pretty much it for me. Here's a nice quote from one of our students, Angus. And one of the things I like about this quote is he notes the flexibility that we offer. And that also is reflected in the flexibility that we offer in psychology in terms of structuring our courses and delivering them as well. All right, I think it's back to you, Anna.
Thank you. Me again. So, now I just wanted to flag that if we go back, so the young lady in the red dress there was my honours student, that's Amanda. So she finished honours and then she decided that she would explore her options, and what she decided upon was to become a school teacher. So we met in Stirling for lunch last year, so I hadn't seen her for a couple of years, and she is well and happy and loves her career as a high school teacher. So this is a good example of where her base knowledge in psychology was fabulous for her to then go on, and now she teaches secondary school psychology, and she is very pleased with that choice and that decision. Angus is still studying with us, but something noteworthy about Angus that you might be interested in, that we have a very active student society, psychology student society. So Angus is a member of that group, and the students might talk a bit more about the PSA later. I'm not sure if you're going to talk about that, but I saw him the other day because he and his colleagues in the PSA arranged a really nice careers night, but they also have a ball and they have dinners and they have pub crawls. So it sounds like you might be, you know, in a large group of students and you wouldn't meet other people, but in fact there's lots of opportunities to be sociable. Now, if you decide that you want to go on and become a psychologist, which many people when they start psychology think that they would like to do, although like Amanda, as I've just flagged, sometimes you change your mind along the way. Some very important things to know about whichever school that you choose to study psychology, whether it be this one or any other. If you want to become a psychologist, you must make sure that you enrol in, study in an accredited school of psychology. So the University of Adelaide is accredited by the Australian Psychology Accreditation Council. We just got the paperwork to say that we've passed all the tests with flying colours. So external group comes every 5 years and they monitor what we're teaching, how we're teaching it, our staffing, our graduate attributes, our graduate outcomes. And if they're not satisfied with something, they ask us to fix it. And then if they're not satisfied, you can be unaccredited. We are accredited, so this is good. What that means is that once you've finished your honours degree, you can apply to become a master's student, or there are other routes to become a psychologist, which I won't bore you with today. We'll focus on masters because that's what we're offering currently in the school. So if you've done the accredited 4th year, then you can apply for a master's program, and then at the end of that master's program, you can register as a psychologist. When you register as a psychologist, then you can apply for a Medicare number, and then you can go out and work in government, or you can work in private practice, or a blend of both. So I am a health psychologist, so I'm a registered psychologist. I have endorsement in health psychology, and every Tuesday afternoon I go to a private practice in a GP surgery, and I work with people with physical health problems. So primarily people who have had or who are seeking bariatric surgery, but I also work with people who are older and going through grief and loss for various reasons to do with their health, or people who've had acquired brain injury. So health psychology is not the most famous branch of psychology, but I would argue it's the most rewarding for me at least. The other psychology that's perhaps more famous or well known that people go for straight away when they think of psychology is clinical psychology. So clinical psychologists, again, just like any other registered psychologist, they need to do their honours year that Peter described. Then they apply for a master's program, and because you've done an accredited degree at this university, you would apply for masters all around Australia because it's quite competitive to get a place. Then once you get into the program, you will be learning about the assessment and diagnosis of mental illness. So a clinical psychologist is focusing on more things like severe depression, anxiety, schizophrenia, bipolar, all those kinds of psychiatric or psychological illnesses, and how to best treat them. All psychologists, because of our rules about being registered, have to be proficient in treating anxiety and depression and understanding a number of psychological tests. So it doesn't matter what kind of psychologist you want to be, we all have to learn those things, but the clinical psychologist will go more specially down the mental health, mental illness pathway. The health psychologist, as I've said, so I won't talk too much more about it, but again, just like the clinical psychologists, we do our 4th year, then we apply for the 5th year. You can currently apply for this program at University of Adelaide or University of Queensland. They're the only 2 places that offer this one. We look at the relationship between psychological and physical health. So we take a biopsychosocial model. And again, just like any other psychologist, we have to know about basic knowledge so that we can register, get a Medicare number and work. The organisational psychologists are a little bit different to the clinical and health psychologists. They tend not to work one-on-one in a clinical setting, although they can. What they more likely do is they work in big organisations. So they look at things like human resources, management, workforce planning, recruitment, all the things that are listed here. The organisational psychologists at our school not only learn about organisational psychology, but in our school we have a strength of human factors. So learning about how people make decisions, for example. And so you would learn a lot about that if you chose a Master of Organisational Psychology as your career. These people also have to register with AHPRA, so the registering board, and they also can apply for a Medicare number. Many of them don't, but it is an option for them, just like it is for any other master's person. So later on there might be questions about postgraduate training. I would just like to flag though that when you finish your honours, you might decide to do postgraduate training in something not psychology. So a number of our students, after they finish, they think, oh, actually psychology wasn't exactly what I thought. A number will go on and apply to do postgraduate medicine. They will apply to do postgraduate nursing, mental health nursing, for example. They will get some credit for the study that they've done in psychology. Some will go on and do psychotherapy and counselling, and we have psychotherapy and counselling here at this university. A number will go on and apply to do postgraduate studies in social work. A number will go on and apply to become a teacher, like Amanda, and so on and so on. So there's limitless opportunities once you've finished. So now I'll hand over to you. And I think you're getting to see it.
That's great. Thank you. So I'll just touch briefly on a few extra things before our student panel. So one thing that's really important to note is that when you first start university, there's a lot of things that, aside from the content of the course, there's a lot of things that you won't be familiar with. One of the main things is enrolling in classes, selecting class times, and developing a study plan. There are people there to help you do this. So if you're confused, like I was when I started studying and I completely messed up my timetable, there will be people there to help you with that. So you just need to make an appointment with an advisor in the faculty, and they can help you customise that for what you want to do. For example, if you have a particular major that you want to take or something like that. There's also other things they can do, like if you've done any previous study, they can help you with credit applications, so you might be eligible for credit towards your degrees as well. But it's always worth getting in touch with the program advisors for some assistance about that. We also have our peer mentoring program, which is an informal way for both international and domestic commencing students, so first year students, to connect with senior level students. And they can help with things like little tips and tricks, showing you around campus, helping you make friendship groups. I know that Matt has been involved in that, so he might be able to tell you a bit more about that later. And we also have our Indigenous support services in the university. So within the university, there's the broader unit, which is Welsh Yarloo, but we also have our Yaitja Karuna Indigenous support service. So they look at a lot of different factors within the faculty, but mainly supporting students and also making sure that the programs are connecting with Indigenous students as well as staff as well, which is really important. So if you're eligible for support through them, I would definitely encourage you to get in touch with them when you're a student with us. We also have a range of scholarships on offer for both commencing students and current students. So it's worth looking at those on this website here. There's a list of them which you can search by categories, so faculty or whether you're a commencing or current student. I would definitely encourage you to browse through them because there can be a lot that you didn't realise you're eligible for. The worst thing that can happen is you've spent a couple of hours filling out some forms online. The best thing that can happen is you get the scholarship, which is really exciting. So definitely take a look at that site. We also have specific scholarships, as I mentioned earlier. For example, our Yaitja Karuna Health and Medical Scholarship, which supports Indigenous students who are commencing, so starting students. And one of the key sort of draw cards for this is that it awards successful applicants $10,000 per year for the duration of the degree, which is very exciting. So you can read a little bit more about all of those scholarships online. So now I'd like to introduce our student panel. So we have here Beck and Matt. So they're here to answer any of your questions that you have about what it's like to be a student or anything at all that you'd like to know. We also have our academic staff if you have a question for them, or I can answer any questions as well. So they're here to help you. Is there anyone who's prepared some questions already or has some questions they've thought of whilst we've been speaking? It's sometimes hard to think of questions. Oh, we've got two straight away. I'll go to you first and then go to you next. Yeah, you?
What subjects would you recommend during the senior school? Like I'm in year 10 now.
Yeah. So the question was, for those listening online, what subjects do you recommend for senior years in high school? From my perspective, for your reference, there's no prerequisite requirements for psychology, so you don't need to have studied any specific subjects in order to receive an offer into psychology. However, you might find that there are certain subjects that would help you more rather than some more than others. There are some schools that offer psychology as a subject, so naturally that would be a very good one to select if you have that on offer at school. There is some statistics involved in psychology, so you might find some mathematics subjects would be really helpful. Do you have anything that you'd like to add to that? No?
No, you don't have to study psychology.
Yeah.
Just to repeat that.
Yeah.
But obviously, if you're interested, it wouldn't hurt to do it. Because something that we can't predict is what you're going to get taught or how you're going to get taught in year 12. And so the quality of what you learn may or may not be helpful to you. And that's not to disparage anyone who's teaching U12 psychology, but we get different levels of understanding when people come in. So it's a long way of going. If you're interested in it, have a look at it, but it may or may not reflect what psychology is all about.
I'll get hand over to Beck as well. She's something she'd like to add.
I just wanted to say that I was pretty fortunate at my school to actually be able to study psychology in year 11 and 12. And I found that background knowledge actually quite helpful to cement the information in first year because it did reiterate a lot of those concepts. So I'd say if your school is fortunate enough to do psychology, I'd say give it a go, get a head start, see if you actually like the concepts and the things you're learning. So then when you do come into the degree, you're like hands-on and ready to go. So that's my little bit of advice for you.
And can I just say that when I was at school, I was terrible at maths. And if any of my old teachers are out there, hello. So I failed maths. And so I was very frightened to do psychology because of all the stats. And then when I got there and I was calm about it and just did it in a calm, measured, rational way, I realised actually I can do it. I'm not very good at maths, but I can do stats. So you don't have to do maths. I think if you don't like reading, you don't like thinking, you don't like critiquing stuff, you don't like writing things, then probably psychology is not going to be for you, but then probably not much is going to be very interesting to you in this faculty. So I think anybody, sometimes you'll be surprised how much you love it, or you'll discover it's not for you, but I think pick things that you enjoy.
One thing I'll also add about the maths as well is if you are struggling with any of the maths kind of topics in your degree, we do have our Maths Learning Centre, so you can go seek the support of some of the staff there. They're really massive maths geeks, so they love to talk about maths all the time. So if you struggle with that, that's another support service you can take advantage of as well.
Can we just quickly add one more?
Oh yes, yep, sure.
So something else to add is that we use a statistics program called R, which is open software, so no one has to pay for it. And we have a dedicated R tutor for everybody in our school to be able to come and see that person for help.
So if you're freaking out, you get special help.
There's a question at the back as well, yeah.
I'm interested if you're able to summarise it very briefly, what the difference or defining factor is between, say, Bachelor of Health and Medical Sciences majoring in neuroscience versus doing a psychology degree. What might be a good takeaway or difference in each?
Yeah. So the question for those listening at home is there, if you could briefly summarise the differences between within a Bachelor of Health and Medical Sciences, the neuroscience stream, versus a Bachelor of Psychological Science. Would you like to go into that?
Yeah. All right. Well, basically, if you do a Bachelor of Health and Medical Sciences and you're not majoring in psychology, then you can't become a psychologist and you can't enter honours psychology. So if you think that you want to go more down a neuroscience pathway, but you would also like to have the psychology option, if you do a Bachelor of Psychological Science, you could major in neuroscience and psychology. If you do a Bachelor of Health and Medical Sciences, you're going to be doing a lot more lab work, like wet labby work and science-based things, medical science stuff that we don't do. I don't know if you wanted to add anything.
No,
So that's in a nutshell. So either option is good, it just depends on what you prefer.
And Matt as well?
So the psychology with a neuroscience major is actually what I'm just about to finish, and you'll find that the neuroscience content, there'll be a lot of anatomical sciences involved, which you don't necessarily need in psychology so much. The neuroscience content is really interesting. I find it's a really, really good addition to the degree. I've really enjoyed what I've been doing in the neuroscience side of things as well. But it is just a slightly different focus. You'll be going into more of the anatomical sciences and other things like that. But that's an excellent way to get kind of biological basis kind of information you can use towards psychology. Yeah.
Any other questions that anyone's thought of?
What's the difference between the Bachelor of Psychology and the Bachelor of Psychological Science?
Yep. So the question was, what's the difference between the Bachelor of Psychological Sciences and also the Bachelor of Psychology Advanced?
Okay, so I guess there's a couple of differences. One is that the B-Psych side, the Bachelor of Psychology Sciences, that's 3 years, and then if you're interested in going on to honours and possibly clinical or health or organisational masters or doing a PhD, then you apply to get into honours. The advantage of the B-Psych side is that you have the option to do a second major. If you are in the if you're in the advanced program, firstly you need to get into it, so that's requiring you to get at least 95. Let's say you get in. Then you are, apart from first year and second year where you will do some electives, in third year you're doing all psychology, so you don't have the opportunity for a second major. But you also, if you maintain good grades throughout, then you automatically go into honours. So you take away, I guess, a bit of anxiety about whether I might get into an honours program or not. And the two programs will also have some different courses that different students do. And as well, in the advanced program, you'll have the opportunity for mentoring and the small cohort experience as well. Does that help?
They're both excellent.
One thing that might help you as well, if you're a visual person like myself, is on the faculty's webpage, so that's health.adelaide.edu.au. On the left-hand side, there's some menu options. One will be student support, and you'll be able to see study plans there. So you can actually visually see what subjects you do in each degree and how long it is. And that might help you compare the two as well. Because I sometimes myself, I'd like to see things in front of me and see which subjects. You'll be able to see the program structure and the ability for majors and things like that. So that might be helpful as well. Okay. Any other questions anyone has? No? Excellent. Maybe I have a question for you, Matt, if you wouldn't mind answering that. Just for the reference of everyone else. Can you tell me a little bit more about your involvement in the peer mentoring program?
Yeah, so as mentioned in the slides earlier, we offer the peer mentoring program for first year students, and essentially the way it works is you get paired up in typically small groups, 3 to 5 people or so, with a mentor. You'll end up getting a chance to basically sit down and talk about some stuff one-on-one, people that have studied the same subjects you've just studied, some tips and advice they might have to do with those, as well as some other useful tips. There's a lot of things going on when you first come to university, and it's quite easy to kind of get tripped up by them. Little things like, how do I use the printers? Those types of things can become a bit of an issue. I mean, I'm just about to finish the program and I just realized the printers can do stapling as well. So don't be me and get the help from somebody that understands these types of things early to save yourself the hassle. The other little things, other tips and tricks, things like the hub, where most of the computers are, will get quite busy sometimes. There are a few other hidden away study rooms and things like that. But yeah, generally peer mentoring is generally a weekly or fortnightly email, as well as weekly or fortnightly meetups in a group or one-on-one if needed as well. It's just generally a fairly good way to kind of be introduced to other people in your program at the university. Yeah.
Okay, thank you. Are there any more questions before we finish up? You are more than welcome to come and ask us.
I've got a question.
Oh, you do? Yes.
Of both of the students. So, would you recommend that people study psychology at the University of Adelaide? Something you think they should do, or should they do something else? Or?
Oh, yeah, definitely. Psychology is a really good broad degree. I really like the flexibility part as well. It was mentioned earlier, but I've really enjoyed the being able to pick things up in different areas because psychology is so broad. It gives you the opportunity to take subjects from different areas. I've taken a lot of human biology, anatomy, and physiology. as part of the program, and I've really, really enjoyed that stuff, and I think it really augments psychology, particularly the biological basis kind of aspects. And going into psychology, I really enjoy individual differences in personality, which comes in a little bit later in the degree, but you get a lot of that in first year as a kind of primer as well. Yeah.
And what's your plan for next?
I'm going to apply for honours, so we'll see how that goes.
I'd personally say I definitely did enroll in the right degree. I really, really love psychology and all the things to do with it. My main kind of goal in life is to help people. So by applying these like concepts and having that knowledge to actually do some good in the world, I think that's like the best thing ever. So I'd say yes, and I think that's what I want to do for the rest of my life.
So what year are you in now?
I'm in second year. So
And then what's the plan after second year?
the plan is honours. Hopefully I get in. If not, I will apply all the way around Australia. And I'd like to do something with youth work. I'm really passionate about the youth in our community, so I'd like to do some good stuff there.
So are you planning to go on to masters or?
Definitely, that's a goal as well. There's a to-do list that keeps growing and growing and growing.
Great.
Thank you so much. Thank you. And so if there's no more questions, I might finish up there. And thank you so much for attending today, especially considering it's looking pretty gloomy outside. So thank you for coming out. And thanks to those who are listening online as well. And we hope you've enjoyed your time with me and the team. And we look forward to seeing as many of you as possible as students in psychology, maybe next year and maybe in a few years' time. And if you're wanting to stay for another session, you're more than welcome to vacate the room, or if you have any other questions for us, you're more than welcome to stay around and ask us. And also the session will be available to watch again on Facebook, so if you'd like to see our lovely faces again, you can do that online. Thank you so much, everyone. Have a lovely day.